Hi, I'm Dr. Kaushik. I'm a senior consultant rheumatologist. I work mainly in Chennai. So in this video, we're going to look at a condition which we encounter in our clinics. It is called Ankylosing Spondylitis. Now it is addressed by different names. People call it spondylitis, ankylosing spondylitis, but the latest terminology is something called seronegative spondyloarthritis, which the name encompasses what it actually means. It affects the back, hence the name spondylitis, as well as it can affect the other joints as well, hence the name arthritis. Now, what is ankylosing spondylitis? As with all the problems we encounter, most of the problems we encounter in the rheumatology clinic, it is an inflammatory condition. Inflammation means you get swelling and swelling in the joints. In this case, the inflammation predominantly affects the spine. So it is an inflammatory condition. It is a chronic inflammatory condition. It lasts for a long time, and it can affect the back, it can affect the joints, it can also affect the eyes. Some people present initially with something called uveitis. It mainly affects the vision. Now, who gets seronegative spondyloarthritis or ankylosing spondylitis? It is usually the young men who are affected by it. Why do we get ankylosing spondylitis? Now, there are different theories proposed, but the most common reason is there is a familial predisposition. So if you look in a family who've got a relative with ankylosing spondylitis, it is 30 times more prevalent in the other people in the family. So there is a genetic marker called HLA-B27. So if you have a HLA-B27 positive, then and a relative with ankylosing spondylitis, then you're highly likely to get it. But it doesn't mean that if you have HLA-B27, you will definitely get ankylosing spondylitis, because it is seen up to 5 to 10% of the normal population can have the HLA-B27 tissue typing. So what do people with ankylosing spondylitis usually present with? They present with back pain and usually stiffness in the back and other joints. So they have difficulties with activities of daily living, which means sitting down, standing up, walking, especially getting comfortable in the bed. So they have difficulty turning in the bed. This is especially true at night and first thing in the morning. They will have difficulty getting out of the bed because of extreme stiffness. Now, how do we diagnose a patient with ankylosing spondylitis? Diagnosis, as with all conditions in the rheumatology clinic, is by taking a proper history and doing a clinical examination. Now, as regards to blood tests, there are not many which we can do to confirm a diagnosis of ankylosing spondylitis. The best test to do would be to do an MRI scan, because that picks up the spondylitis at an early stage, and we could institute the appropriate treatment for that. Now, how do we treat people with ankylosing spondylitis? Now, things have come a long way over the course of these last few years. Now, say going back to the 1990s, there were not many good treatments for ankylosing spondylitis. The only treatment was to put them through an exercise regime. Does physiotherapy cure ankylosing spondylitis? No, it doesn't cure it, but it keeps them mobile. So physiotherapy is helpful, but doesn't cure the problem, as opposed to the popular belief. So what actually can cure ankylosing spondylitis, or is there a drug that can cure ankylosing spondylitis? Now, there has been lots of research done in this area, especially since the new millennium, 2000, 2002. Now, there are newer medicines called anti-TNF alpha medications. They are extremely good in the management of ankylosing spondylitis. They were initially developed in the management of rheumatoid arthritis, but show very good promise in spondylitis. Now, what the research says is, if we can identify a person early on in the disease process, so essentially within the first 6 months of the onset of the problem, make a robust diagnosis by using the newer imaging techniques like MRI scanning, and institute the biologic treatments in them for anywhere between 3 to 6 months, we could achieve a remission, which means almost a cure. So, gone are the days when people, if I could show to the monitor, gone are the days when people presenting with ankylosing spondylitis had to go through an unfortunate journey where over the course of the years, due to lack of treatment, their spine keeps bending. Nowadays, instituting the right treatment, we could hopefully prevent the process in most of the people. But what do we need? We need early diagnosis and an appropriate assessment by a trained professional in the management of these conditions. This brings us to the question, who's the right person to treat ankylosing spondylitis? Is this a general physician, an orthopedic surgeon, or a rheumatologist? I'm going to ask the same question to you. Who do you think? Correct, a rheumatologist. Who would be the right person? But we have to use the associated healthcare professionals in the management. So we do need an orthotic specialist for instituting the appropriate footwear in patients. We need the help of a physiotherapist for the adjunct therapy rather than the only therapy. And we also need to use the newer regimes in a controlled manner under close supervision after appropriate assessment. So what I would recommend now is, in case of symptoms, do contact a healthcare professional as soon as possible. Thank you. Thanks for listening.